Yes, stress is huge. And we just live in this like busy, fast paced lifestyle. It's like hustle culture. It's like cool to be stressed out all the time. It's not cool. And your hormones don't love it. Your boss might love it, but your hormones don't.
Hi, guys, and welcome back to the Thick Thighs Save Lives podcast. I'm Kelsey.
And I'm Rachel. Guys, we are so excited. This is the episode we've been wanting to bring you. We have Cory Ruth, who is going to answer all of your hormonal women questions about PCOS, which I just learned today. You say PCOS. And this is the hormonal episode that we have been wanting to bring you guys for so long. So I want to start by just welcoming Cory onto the podcast. Thank you so much for being here.
Ooh, yes. What an intro. I love it. I'm very happy to be here. And let's dive in. There's so much to explore around this area, and I'm so happy to share.
For sure. We're going to dive right in and tell our listeners about your personal journey with hormone health and how it led you down the path of helping and educating other women.
Sure. So back in high school, when we got the very, very minimal amount of sex education that we got, I was always very curious about the whole, everyone gets a period every 28 days, right? And we ovulate on day 14, and, you should expect your period every month. And I was always like, okay, where is mine? What's going on? Because it would just be totally random, right? It wouldn't come every 28 days. I had no idea when it would show up. And I didn't know why. I thought there was something really wrong with me. And I carried that with me for a long time until I started to learn a little bit about what's called PCOS, which stands for polycystic ovary or ovarian syndrome. And it's pretty common. They estimate 10% of women have this condition, and it's the leading cause of infertility. So, anywho, fast forward, I became a registered dietitian. And throughout my grad school years, I was just really fascinated by women's health. I loved learning about endocrinology. I loved learning about hormone balance and periods and all kinds of issues, within that PCOS, endometriosis, infertility. So I kind of made that my area of focus. And after I graduated, I worked all these different jobs, and I really wasn't into a lot of them. And I decided to work for a women's clinic, and I learned a ton. I worked alongside some really talented, very intelligent OBGYNs, and I was able to learn a lot about women's health. So I kind of, it was kind of the perfect combination of my background as a dietitian and my experience there, and my own personal experience and journey with PCOS, and just being always endlessly fascinated with hormone health. So when I first opened my doors to my private practice, I said, okay, the one thing that I'm never gonna work in is PCOS. Too complex, too complicated. I don't want to touch that with a 30-foot pole. But then as time went by, I realized, there's such a huge connection between nutrition and our hormones. I'm kind of the perfect person because not only am I a dietitian, and not only do I have PCOS, this is an area that I have experience in. So dragging my feet. No, I'm just kidding. I jumped in, and I opened the doors of my private practice, and it took off. I started this Instagram account, this little thing back in 2018, and it has just grown so much, and it's grown into an amazing community, of resources and relatability, I think, too. In kind of knowing, you're not alone if you're dealing with any kind of hormonal imbalance, and there's answers for you outside of a doctor's office. Because when we go to the doctors, we're given very little information. Or if we get our labs drawn, we get our results emailed to us. We get a bunch of numbers and acronyms. Nothing is explained to us. It's very confusing as a woman, and women's bodies are just endlessly fascinating and complex. So my mission is really to help women understand their bodies, understand what's happening hormonally, how that affects our weight, our energy levels, our metabolism, our mood, our digestion. All of these things are impacted by our hormones, and helping to really bridge that gap between what's happening there and how can I use that information to apply, different tools that can be helpful for me.
Wow,
Yeah.
that's incredible. First of all, thank you so much for all the work that you are doing, because number one, it can be just so difficult to be in a doctor's office and try to explain these super complex symptoms that we're experiencing and get such limited hard stop on the limited knowledge in sex ed to begin with. Like, you get a period
Right.
and this goes here and you'll get pregnant is the extent of
Right.
sex ed. Like, let's be serious. And then everyone's kind of left just wondering what happens. And even as you get older, I'm in my 30s and I'm still so how does this
Totally.
work? And you're right. When
Yes.
we get labs back, you go on there and you're like, okay, but no one's even explaining this to me. So I'm not a
No.
doctor. I don't know what I'm looking at, and I don't even know if my symptoms were addressed, you know?
Right.
Also,
There's a huge gap in healthcare there.
yeah.
Yes.
Also, just
Hmm.
for anyone who is not viewing this on YouTube, Corey's holding the most adorable guest that's ever been on the podcast. So you guys just yeah.
I'm
If
gonna
you're
be
not
honest,
watching on YouTube, you are missing out.
it's hard to look away, and honestly, I can almost smell, the baby smell. Listen,
My ovaries are burning.
this is what I'm saying. If your ovaries weren't already burning by all of the hormonal talk, we got a baby, guys. We got a baby.
Too funny.
Cory, again, I just
Yeah.
want to echo, thank you for, all of the work that you've done, because again, I just feel like so many women feel so alone. And
Totally.
on that note, with women's health issues, the constant phrase we're always hearing is something is common but not normal, right? And I'm
Mm-hmm.
wondering, you gave a little insight into huge numbers of women, with PCOS, which 10% is
Right.
an enormous
Huge.
amount. Um,
Yes.
how common are hormone imbalances, and how often do you think that they are underdiagnosed or misdiagnosed?
Gosh, that's a great question, and it's a hard one because I think the term hormonal imbalance is vague, right? We don't exactly know what that means, because that could potentially mean somebody has, very little estrogen, and that can cause a whole range of issues. Maybe they have an estrogen dominance profile, so that can cause a different set of problems. Maybe they have elevated testosterone, which we see often in PCOS. So it's totally hard to say, and I would say, I can say this, it's a lot more common than we think, but also hormones ebb and flow, right? We can go through a season of life where maybe we're and I see this too, commonly when somebody maybe gets a misdiagnosis of PCOS, they have something called hypothalamic amenorrhea. They're exercising really hard. Maybe they're not eating to the capacity that they should be. They're at a lower body weight than their unique body wants to be at. So we see lower levels of estrogen. Their period stops. This is not the same thing as, anorexia. This is just somebody whose body needs a little bit of tweaking, right? So that's a season. They can go through that, and then they can come out on the other side, get their period back. Things are kosher. But it really depends on what's happening hormone wise, and things can change over time. Bodies change. They're so complex. So I would say it's more common than we think. And I will say too, that hormonal issues can cause all kinds of symptoms that we don't always realize. For example, if somebody is dealing with hair loss, maybe we think about low iron or low B12 or stress, but that can also be coming from your thyroid. It could be coming from elevated androgens like testosterone or DHEAS or DHT. So a lot of symptoms we may not think about can go back to issues with our hormones that need to be addressed.
Yeah, I mean, it's such a complex question, and I think so many women have, such a range of symptoms, and some of
Right.
them will be, newly present, and some of them will develop over time, and some of us are like, okay, but what is going on now? So can we
Yeah.
talk about some of the other symptoms that you might see with PCOS? What should women be kind of looking for?
Yeah. So basically, with PCOS, you have to meet 2 out of 3 diagnostic criteria. So the 3 things are: number 1, irregular periods. So when I say that, that's not applying to somebody who maybe has a period every 28 days, and then maybe next month it's day 30. Maybe the next month it's 29. That variability is normal. What I mean when I say irregular periods, outside the window of your period coming roughly every 21 to 35 days. So if you're getting a period every 35 and then it switches to 75 days and then maybe 17 days, that variability is very indicative of something like PCOS, or you're not having a period at all, or you're getting random spotting and random bleeding all the time. So that's number one. Number two, you have symptoms of elevated androgens, and that could be facial or body hair growth on women, hair loss on the head, acne, weight gain, or you're diagnosed through lab work, right? We get lab work done, we get some blood work done, and the doctor sees, oh, there's your testosterone is too high. So that's number two. And number three are polycystic ovaries. And you have to have a pelvic ultrasound to see that. And that's an easy thing to do and ask for. But polycystic is a kind of a misnomer, because PCOS pain is not a symptom. Okay. We talk about cysts, women have these big baseball sized cysts and they rupture and they cause pain. That's not the same thing as PCOS. Our cysts are really just underdeveloped, immature follicles because we're not ovulating regularly. And the way that I describe it is they're all competing to ovulate and nobody's winning. So you can have big cysts that are painful concurrently, but they're not associated with your PCOS. So that's a big misunderstanding in this community, and a lot, when you talk about things on social media, people are very confused for good reason. But if you're meeting 2 out of 3 of that criteria, then you can get a PCOS diagnosis. So we oftentimes see insulin resistance. With PCOS, you obviously have to have lab work that indicates that. You get your A1C or your fasting glucose or insulin checked. That can show you insulin resistance, but that puts us at a higher risk for type 2 diabetes, either now or in the future. There's really no symptoms per se. It's more like a lab value, but you'll often get signs that you have that. It's really hard to lose weight. You have crazy carb and sugar cravings. So it's different than diabetes, but it's sometimes can be a stepping stone for that.
Wow, there's just so much good information here, and I just feel like I'm here to learn. I absolutely thought that cysts were, I guess this is probably a common thing, but I absolutely thought the presence of cysts was like a PCOS kind of symptom. Kelsea,
Right.
did you think that too?
Yeah, I definitely did. And just okay, if you have frequent cysts, should you be tested for PCOS, and just kind of how to be tested for PCOS, which you gave some really good insight on what to even ask for. Because I think, a lot of us, when we go to the doctor and we have presenting symptoms and they kind of leave you with, my experience is they leave you with well, we'll check on something else later, or if symptoms persist, come back, and you're like, no, I'm here, that's why I'm here.
I
Yeah.
waited
It took me 3
6
months to
months
get
for
here.
this appointment.
Yeah.
Yeah,
I'm
exactly.
leaving here with something.
Yes, exactly.
But you don't know what to ask for, and I think that's really difficult, because I find myself even just Googling what should I ask them when I'm there, what tests should I get, because a lot, I think, myself with a lot of women are just kind of at a loss of what, you'd hope that the doctors kind of guide you on what tests to get, but that's certainly not my experience. And I feel like even just that part of the conversation, which I'm going to listen back to, and probably a lot of people will be like, okay, now I asked for this ultrasound.
Yes, yeah. And I can tell you too exactly what to ask for if you suspect any kind of hormonal issue at play. So you can ask for what's called a full hormone panel. And that's going to include testosterone, estrogen, progesterone. I would also ask for a full thyroid panel as well, if you can get that. I would ask for your vitamin D. That's commonly low, and it can cause all kinds of issues with periods and mood and sleep. I would ask for iron and vitamin B12, and I would ask to get your blood sugars checked out. It's, blood sugar issues are more common than we think. So ask for your A1C and a fasting insulin and or fasting glucose number. And that's what I would get checked out. And, that will give you a lot of insight into if anything's going on hormonally, and other tests in there too. But that's a good place to start.
Cory, where have
Oh,
you been all my life?
right? Oh my
Like, it would be
God.
this simple. Like, why?
Yes, I know. And well, that's the gap we need to bridge, I think. And our healthcare world is just so nuts. It's so crazy. And it's by no fault of our amazing doctors. It really is just the way that the system is set up. And, we're ushered in and we're ushered out in 10 minutes or less. And that's the way it is. So we definitely deserve more as women because our bodies are always changing. They're so complex. And, a lot of times we're totally in the dark about why we're feeling some type of way. So,
That's so
yeah.
true. And the other thing is like you said, these different seasons in your life, like
Mm-hmm.
trying to get pregnant, postpartum, like
Right.
menopause,
Yeah.
perimenopause, like there are so
Yes.
many changes. And like you could be
Yeah.
going along, humming along beautifully with your hormones, and all of a sudden you have a baby, and things that have never happened to you before start happening, and there really
Yeah.
is just very little education there as far as like, hey, this is what to expect, or
Yes.
so
Yes.
yeah, that's just such a great list of like, here's a
Mhm.
baseline like to give, so that these are the
Right.
things I want checked, and that can kind of go
Yes.
across the board whether or not you're having, problems in your 50s or in your 20s, because that is like the place
Right.
to start.
Exactly. Yeah. I mean, we spend our whole lives trying to avoid pregnancy. And then when the time comes that we want to achieve it, we're totally at a loss as to what the hell we need to do. And then once we have the baby, we're again at a loss as to how to get back to where we were. And then once we start perimenopause and menopause, we have zero education on that. So it's so nice that I see on social media, things happening in that area. Of course, there's a lot of stuff on there that's incorrect, and that's really frustrating as a healthcare provider to see. But there are wonderful, healthcare providers giving great free education out there on these different seasons of life that we should all learn about, because we're all eventually most of us going to go through them.
Mhm.
Yeah.
That's so great.
Mm-hmm.
I want to zero in a little bit on weight management, fitness, and
Yeah.
PCOS, because
Mm-hmm.
we speak to a lot of women, and it doesn't have to be PCOS, but we do
Right.
hear from a lot of women that they are gaining weight at rates that they've never seen before without changing anything, that their fitness is really suffering, their energy levels are suffering, and
Mm-hmm.
I think that a lot of people do not, maybe now a little bit more, but it previously have not looked at hormones as sort of a culprit. And I just want to
Right.
talk about, specific struggles regarding weight management and fitness and some of these hormone imbalances.
Sure. Yeah. So I'll start with PCOS because that's obviously my specialty, and that's where we see a lot of weight issues. So the connection there, it all has to do with insulin and blood sugar. Now there also is a cortisol adrenal component, which I'll touch on second. So first, this insulin resistance piece, that makes our body want to hold on to weight, and it's really hard to maintain a weight loss. So the other part with the adrenals is that when a lot of women with PCOS have elevated cortisol is our stress hormone. And basically we have this exaggerated response to stressors that somebody else without PCOS might be able to say, all right, well, that's done. And our body is like we're total drama queens. We're overreacting and we're putting all of our hormones on overdrive. Cortisol, again, makes our body want to hold on to weight and not let it go. So you really want to, if you have PCOS, really drill down on blood sugar balance. Of course, exercise can be helpful there, but nutrition and diet is first and foremost, right? We have to take a look at what's on our plate. And we have to understand how to set up our meals and our snacks to be supportive of healthy blood sugars, even if we don't have this classically insulin resistant type of PCOS. Blood sugar balance, and I'll say this too, is important for every woman because it's so tied to how our hormones are behaving and what our weight is doing. So fix your diet first and foremost, or at least I shouldn't say fix, optimize your diet for success there. And then take a look at your stress. Your adrenals are often on overdrive. So make sure you're implementing some really, really, really strong, self-care routines, stress management tactics. That's so much easier said than done. But it is really important. So definitely the other piece to PCOS and weight is elevated androgens can also make weight gain just easier to accomplish. So make sure you are, if you have elevated testosterone or any of the androgens, you're working to bring those levels down. Just by working on blood sugar balance, you can help bring those levels down, but there's other things that can be supportive. You can do different supplements can be helpful to encourage lower androgen levels. My supplement line, I make one, and it's my top seller. It's an amazing one, and it can help to encourage lower androgen production. That's going to be helpful and supportive for the weight piece too. So that's kind of, with PCOS there. As far as other hormones besides the androgens and the insulin, estrogen can sometimes be a culprit too. If we've got elevated estrogen levels when we're supposed to have this more kind of balance between progesterone and estrogen, we can sort of be in this state of estrogen dominance. We store estrogen in our adipose tissue. So we do see that if someone is working on weight loss, it's kind of like what comes first, the chicken or the egg? Are we going to bring the estrogen down and lose weight, or are we going to lose weight and the estrogen is going to come down? It's really tricky, and we don't really understand that. But working on weight management can help with higher estrogen levels, and also working to balance estrogen can support healthy weight loss. So you can take a look and see what your estrogen is doing. The other one is your thyroid. Your thyroid has a huge tie to your metabolism. So if you have hypothyroidism or Hashimoto's thyroiditis, you're going to potentially have weight loss be something that's more difficult to accomplish. So I don't specialize in the thyroid by any means, but I do know that there are lots of great medications to take to help support your thyroid. And there's also some dietary and lifestyle things that you can do to support healthy thyroid hormones. So those are some top ones.
There was a lot of information there. I am drinking it all in. I'm sure, like many people, there was, something you said in there about, your blood sugar levels and also stress levels and managing those too. And I think that's, it's something that is really important to zone in on, because a lot of times throughout our day, as we increase our stress levels, we are also at the same time more likely to go like hours without eating and then get, really low blood sugar. Then maybe we have a spike. So it's one of those things that's a lifestyle thing that can go hand in hand. And it's very interesting and almost encouraging to hear that, those can be a major impact. And a lot of times, when I think about it, I'm like, oh, those go hand in hand for me. The more stressed I get, the more I feel like
Yes.
I am, I'm definitely having my cortisol levels being spiked the more stressed I get. And then I'm just not eating, and then I'm like dizzy, and then I'm probably having a major blood sugar spike. So it's one of those things that's really important to kind of think about and maybe adjust in your day and put some pieces in place that, we can kind of try and manage those at the same time.
Absolutely. Yes. Stress is huge. And we just live in this like busy, fast paced lifestyle. It's like hustle culture. It's like cool to be stressed out all the time. It's not cool. And your hormones don't love it. Your boss might love it, but your hormones don't. So take an honest, transparent look at what your stress levels are looking like, and prioritize that, because that can make or break, what's going on with whatever weight loss or fitness goals that you have, or hormone balance, whatever you're working on.
Yeah. Yeah, it's one of those hard ones, because it's like we know we are in control of that. It's empowering and also frustrating, because you're like, okay, I have complete control over that, and it can have a significant impact on how I'm feeling. But stress, sleep goes along with stress as well. So there's a lot there, because like taking an honest look at what you're doing to impact how you're feeling is just really an individual one. So I want to continue on that nutrition train, and how nutrition impacts our hormone imbalances. And if you have any advice for women who might have an imbalance, how can we be eating different? How can we be nourishing our bodies a little bit different, and using it more as a tactic to get our hormones back into harmony?
Yeah, great question. So when it comes to nutrition for hormone health, I would say, again, always going back to blood sugar balance. It's like the world's least sexy subject, but I'm trying to bring sexy back. So it is so important. Yeah, it's so important. to focus on this. And what that means when I say blood sugar balance is really prioritizing protein, fat, and fiber, not cutting out carbs. Okay, we need carbs. Carbs are still necessary. We're not going, into ketosis by any means, but we're paying attention to how many carb servings we're having throughout the day, and we're trying to be smarter about how and when we're eating them. So, for example, if you think about if we go out to dinner, say we go to an Italian restaurant, we sit down, we get, they serve us some garlic bread at the table, we get pizza or pasta dish, maybe we get the pasta primavera, and maybe it has like 3 broccoli florets in it. Okay, so mostly pasta. We have wine, we have dessert, whatever. So it's like carb, 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 carb. And at the end of the day, we don't even think about how many carb servings that we've really had. So trying to minimize that a little bit is going to be supportive of blood sugar balance. So if you were looking at your plate, you want half that plate to be low starch vegetables. And they could be prepped any way that you want. They can be roasted, steamed, sauteed, however you want to have them, grilled. But half that plate, that gives you a lot of fiber. It gives you antioxidants and anti-inflammatories. So then you want to have a quarter of that plate protein, because that protein is essential. We need that. And that's going to help stabilize your blood sugar. And then we're going to have 1 carb serving. So, that could be half a cup of, corn and peas, or whole grain pasta, or something like that. So it's going to be a smaller portion on your plate. So I always, when I talk to clients or program members, we talk about, well, how do I eat for my hormones, but I eat in a household where, maybe my husband doesn't eat like that, or my kids don't eat like that. Of course, no one wants to be cooking like 3 dinners. Like, ain't nobody got time. So what I recommend is, say you guys are having spaghetti and meatball night. Okay. So you're doing pasta night, and you've got some broccoli there too. Your husband or your partner, whatever, might set up their plate to be a big plate of pasta with some sauce, a bunch of meatballs, a little bit of broccoli. Maybe your kid's going to do a bunch of pasta with sauce, and that's it. And that's what they're going to eat. You are going to have a big plate of broccoli, a little bit of pasta and sauce, and some meatballs. So you don't have to eat all different foods. You don't have to go eat these magical superfoods that it costs like an arm and a leg, because groceries are insane right now anyway. So don't think of it like that. Just set up your plate in different proportions than maybe the person you're eating with who doesn't have a hormonal issue that they're working on. So I'm trying, my goal is to simplify it and make it doable. And this is something that you can do if you do, put in a little bit of thought into how to set up your plate. You can totally do this in a way that's sustainable. So that would be something that I would recommend is, take a look at how often you're eating carbs, and pare that down a little bit. Try not to eat naked carbs. And what I mean when I say that is, if you're going to do like a banana for a snack, or piece of toast, or like a bagel in the morning for breakfast, add something to that, add some protein to that, because that will help to balance out that blood sugar spike from that carb. And try to pick the complex carb, which means it has some fiber. So that's the difference between white rice and brown rice. Not saying you can never choose white rice, you totally can. But if you're doing rice all the time, or a lot of the time, try to do that, complex, that brown rice, to get that fiber in as often as you can, to kind of negate that blood sugar spike. And that's going to keep blood sugar steady Eddie. I do recommend eating regular meals, regular as you can. So what I see a lot of the times in clients is they eat a huge dinner. They don't wake up hungry because they've had a huge dinner and their body's still processing all of that. And then they skip breakfast. They have a bunch of coffee. They go all the way to lunch. They have a little snack because they're busy. Again, the big dinner, and their blood sugar is like tanking, and then it's bumping up super high, and then it's tanking again. We want to keep that line steady Eddie. So try to have a small protein, fiber-rich breakfast. You can do a protein-rich snack in between if you're hungry. Smaller lunch, smaller dinner, and get those snacks in, because that's going to keep blood sugar up. As long as those snacks have some protein, and of course, not every snack will be perfect. That's totally fine. But the majority of the time, if we can aim for that, that's going to set your hormones up to feel safe, to feel like they're happy and safe enough to flow at the right times, at the right amounts.
Oh,
Rachel, did you hear that?
I'm here for it. I literally, okay, I know, Kelsea, I'm listening. Okay, I know, I need to work on that. But here's just what first of all, I just want to say hats off to you and all of the healthcare professionals right
I'm
now.
taking my hat off.
No, never do, because girl,
Perfect.
girl, it's so good. But like, really, the people who are out there simplifying the fact that these things can be done simply by, you don't have to have this special diet where like you're eating different than all of the people around you, that it can be done in just setting up your plate a little different. And the idea that no, if you love a bagel for breakfast every day, no, you don't have to cut it out. You don't have to change your whole entire life and be sad every morning missing your bagel. Just
Life is
add,
hard enough. Eat the
yeah,
bagel.
it's really about the ways that you can add and not about the things that you're taking
Yes.
away or missing. And when you present it to people in that form, it's just so much more hopeful and it's just so much more
Yes.
doable, and you're setting people up for success. Whereas I think that, previously it was just about all the things that you needed to take away. And that is just
Yes.
never exciting.
No. Yeah, there's a lot of there's a big Instagram account about cutting out gluten and dairy, and we just don't have the research to back that up. And the truth is, the more you take things out and restrict, the less doable this diet, whatever you want to call it, it's not really a diet, but this pattern of eating becomes. And we have hormones our whole lives, right? In varying capacities. So PCOS is a lifelong chronic condition. There's no cure. So this is not, an infection that we take a round of antibiotics for after a week. It's something that we have to continuously manage. So let's find a way to eat that is sustainable, that feels good, that we don't have to say, I can't eat that, I can't eat that. I've watched friends do that. I've been there, a long time ago, and it's sad at the end of the day. And it's only doable for so long. And then you feel like a failure when you don't adhere to it, and you become this kind of like hop on the wagon, hop off. And it's just a vicious cycle. And it's not a healthy way to view nutrition. It's not a healthy way to view, food in your life and your body. So yeah, I'm glad you said that.
Oh man, I'm really here for the talk about consistency and the power of consistency over, going hard for 2 weeks and then falling off. And that, like, the power of
Right.
consistency is just something that I really think that a lot of people are getting on board with. And I think that's the
Good.
road to success. And I wanted to
Mhm.
piggyback on your discussion with regards to a lot of the diets that are being pushed. Now, we know that a
Mhm.
lot of times hormone issues come with weight gain or difficulty with weight management. So the knee-jerk reaction is often to go on a diet. And some of
Mhm.
the diets that are out there, intermittent fasting came to mind right away when
Mhm.
you said like consistent meals to like keep your blood sugar in, in a
Mhm.
good form. Um, Obviously you mentioned carbs, and obviously keto came to mind. Some of these
Mhm.
diets that are the go-to for a lot of women who are struggling with their
Right.
weight, can you speak to how these may be further hurting the hormonal issues that maybe got them there in the first place?
Yeah, so it's interesting. I come from a clinical background. I always go back to the science. What does the science say, right? What is the research demonstrating is most effective here? And when we look at something like keto or intermittent fasting, I'll start with keto. We do have research that true ketosis, which is actually really hard to accomplish and stay in, um, if women are in true ketosis, we have seen that helpful. And I'm just talking about PCOS. We have seen it helpful for PCOS. The problem with the studies that we've done, and the problem this translates into real life, is that the majority of the women in the study drop out after a few weeks because it's so hard. And that's the thing about this diet, is because the reason why I don't recommend it is because it's so hard to carry out long term. And then we get into that cycle of, I'm really rigid about something. Oh, I fell off. Oh, I feel so guilty. I'm such a failure. Oh, I'm going to get back on. I fell off again. I'm such a failure. I'm a loser. I suck. Oh, I'm going to get back on. I see this all the time, and it takes a toll mentally. And no, nobody wants to be there. We want to feel confident and like the choices that we're making are sustainable. And again, we have PCOS for life. We have our hormones for life in varying capacities. So we need to find something that's going to work for us long term. So it's not that true ketosis doesn't work. I would say, nearly impossible to continue to do long term. Intermittent fasting, the studies that we have that show intermittent fasting is helpful for weight, the majority are done on men. Women are not small men. We have very different bodies, very different sex hormones. So I don't ever go back to the research on intermittent fasting there for that very reason, because I'm not even going to start there. Intermittent fasting is also can be, and I know there's different kinds, but it's very difficult to carry out as well. I mean, who wants to be like, oh, sorry, I can't celebrate, my birthday dinner. I'm not in my eating window. That's just so restrictive. And we get into that same cycle of, oh, I fell off. Oh, I'm back on. I fell off. I'm back on. And that's just, it's not healthy from a mental health standpoint. And it's not healthy for your body, and your hormones want to feel safe. I mentioned that earlier. What I mean when I say that is, if you think about stress, extreme stress, chronic stress, back in the day, right? If we were running from, our ancestors were running from a saber-toothed tiger, right? And we've got all, we're running for our lives. Our sex hormones are not going to say, ooh, now's the time to make a baby. We actually, our bodies have this function, which is amazing, but also can be frustrating, that shuts down our reproductive function when we are stressed out. So, and the reason why is because it's protective from a biological, physiological standpoint, right? But now in our modern day and age, we can still have that shut down if we're too stressed. Maybe we're under fueling and over exercising, or overtraining. Maybe we are just overly stressed because of XYZ going on. Maybe we're grieving. I don't know. Or we've had trauma, but that same function can come into play, and our hormones are affected by that. So if you keep stressing your body out with these rigid diets and you're hopping on and off the diet train, it's stressful on the body, and your hormones are going to be much less happy with you than if you just chose something that wasn't as extreme, that wasn't as sexy and as trendy, but you stuck with it consistently. Your body's going to be in a much, much, much better place. And I've seen that play out so many times.
Yeah, that's some great advice. You touched on it a little bit there, but I did want to talk about training a little bit. We've kind of dipped our toe in the water throughout this conversation, but I do want to talk about it for women who have PCOS. Do you suggest they adjust their types of training? Is there an ideal type of training? What should we lean into, and what should we kind of stay away from, if any?
Yeah, so it's just like nutrition. There's no one exercise that's bad for PCOS. It's my recommendation, what I kind of teach, is to have a variety. So strength training along with some cardio, along with what I call restorative workouts that can be really healing for the adrenals. So that could look like yoga, walking, like a gentle hike, gentle Pilates, slow biking. A good mix of that, from my experience, brings the best results PCOS wise. So that's pretty much what I stick to. It's not that you have to completely avoid XYZ. If you really love CrossFit, don't do it 7 days a week for 8 hours. I don't know who would,
That's
but
a lot of CrossFit.
that's a lot of box there. So don't pick something and just do it all the time, because that can be stressful. But pick something that you like to do and do it a few times a week. It's just like food. There's nothing, you don't have to go crazy extreme and take things out completely, and you don't have to add any one thing in. I just like to see a mix of those three types.
That's fantastic advice. I think that's, I've got a tough one, and I know that you cannot speak to every case, but so many of the women that we have spoke to are feeling very hopeless with PCOS, with endo, with so many of the hormonal issues, like you said, that people are living with, that there isn't a round of antibiotics that they can hope to feel better in a week. Is there hope for women to feel like themselves again? That's often the phrase that we hear, that, I really would just like to feel like myself again. Is there a track nutritionally and, to get your body to a place where you can kind of feel like yourself?
Definitely. And I've been there. My gosh, I've been there. I mean, in college, I was probably almost 50 pounds heavier than I am now before I understood what PCOS was and how to work on my hormones. So absolutely you can, but I will say it doesn't happen overnight. I think in our day and age, we want to Amazon Prime our healing. We want to Amazon Prime our weight loss. And it's just not that way. So if you're patient with yourself and you have realistic expectations that this process is it's going to be an ongoing journey. And if you lower that expectation, lower the bar a little bit as far as the timeline goes, and be patient with your body, absolutely you can. And it's going to take some work. There's not one medication for PCOS. There's not a PCOS pill, right? There's not one PCOS supplement. It really depends, or I will say hormone balance too. You see these, supplement hormone balance blends, but it's like, well, everyone has a different issue. So what are we really targeting here? So there's not one thing that's going to be helpful. It's going to be kind of a culmination of things. And get your labs done. See where you are hormone wise first. Go from there. Work on your diet, exercise a little bit, add in some movement, add in some stress reduction, whatever self-care routine you want to do. And you can see changes happen in, as little as a few weeks, but it could take a few months. Every body is different. And there are tons of supplements and or medications you can take that are out there for you that can be more specific to your needs. And that lab work can help you understand what those are. But it's a process. And PCOS too, or any kind of hormonal issue potentially depends on what it is. But, it's not like we work on our PCOS and then we're cured. We're good. We're like, it's not like I'm walking around like everything's perfect, No, no, it's a process. And if I stopped doing all the things that are supportive of my PCOS, what would come back? All of my PCOS symptoms. So it's something that we have to continually work on. But I will say, just like with everything, the longer that you do it, the easier that it gets, because the better you understand your body and what it needs. So any symptom that you have, that's your body communicating with you. It's trying to tell you something. So listen to it. Your body is your best barometer. Listen to it and try to understand what's happening and take those active steps to get there, and be patient, and it'll take time, but you can absolutely get there again. You can.
Thank you, Cory. That was a great answer that just filled me with hope. So I think a lot of women listening will feel that as well, because some of us just want to feel like ourselves again. We just want to feel like we are in with our own bodies, and that we are feeling like we want to feel and can go about our lives the way that we would like to. And with some adjustments it can be like that, but this whole conversation has definitely filled me with hope, because you gave some actionable steps and some changes that a lot of people could implement right now today to just kind of start to feel better again, and just start to evaluate what could be causing us to feel some type of way. What could be, how are your stress levels? How are you feeling on a daily basis? And that is just a tremendous amount of hope. So thank you so much. And I want to let our listeners know where they can hear more from you.
Totally. So I'm most active on my Instagram account, which is at the Women's Dietitian. So I post there all the time, and I post a lot of juicy little tidbits on hormones and PCOS and all kinds of stuff, weight loss, fertility. Those are kind of the two areas that I work in. So you can find me there. My website's the same, www.womensdietitian.com, and my TikTok handle is the same. I have a supplement line called Vita PCOS, which is for women with PCOS. That's really wonderful and has done so well in the last year, helping women with some of their symptoms. So definitely check that out too. And I run 2 PCOS programs, one focused on fertility and the other and there's a weight loss component. And then the other one is strictly PCOS weight loss and symptom management. So definitely check those out. I run those a few times a year if you are looking for some further guidance from me.
You are such a rock star.
Dude, she's out there doing the good work. Oh, man.
I mean, someone's got to do it.
You are doing it eloquently.
No, I love what I do.
Eloquently.
I love what I do.
And with a good hat.
Yeah. Greasy hair and
a baby in hand. So.
Yes, yeah. I know. Well, talk about hormones. I'm almost 4 months postpartum, and my postpartum hair loss is like raging. So I'm like, you know what? We're gonna have it like almost every day until it's done. So hormones are so powerful; they're so strong, but we do the best we can.
Yeah, but they're in seasons. It's
Yeah,
so wild. You know what?
exactly.
Women
Thank
are
you
crazy.
thank you. Right, I know.
Oh, Cory, well, thank you so, so, so much for coming on. I can't wait for everyone to
Yes.
hear this. And guys, definitely check her out. Check out all of her sites, all of her social media. We will share them in the show notes. You can kind of just easily get to her if you want to hear more about her. But thank you so much.
Absolutely. Thank you for having me.